All right, good morning. I want to thank you all for joining us today this morning. My name is Ronnie Laralde. I'm the Executive Director of the Edinburg Chamber of Commerce. Of course, today's a very important topic regarding our healthcare update, acts, and a few other initiatives that are taking place that we wanted to discuss. Mr. Mario Lescano is our Vice President of Public Affairs as a volunteer for the Edinburg Chamber of Commerce. Of course, he works at DHR Health, and he's going to lead the way today in this morning's meeting. Mario, thank you for joining us this morning.
Good morning, and thank you so much for allowing us this time. Thank you for the Edinburg Chamber of Commerce for continuing to be involved in this time of pandemic crisis. As we are going forward, I think it's important for us to also understand the importance of other events and activities that are taking place that are a great impact to our region. One, of course, is making sure that we continue to push the information on the census, and I know Mr. Albert Morales from the Census will be speaking to us, and also ACT, which is the voting initiative, and I know Mr. Carlos Martinez is there also. These are important entities that are here with us today, so that we can continue those services of promoting through our chamber region-wise what's important, and making sure that we provide the information via Facebook. So this information will be is being recorded, and it will be played back so that everyone can receive that information. I'd like to start off with introducing our chairman, our president of the board, which is Hiran Govind, and he is overseeing the Edinburg Chamber of Commerce at this time, and we'd like to thank him for the opportunity to allow us to record this and play back on our video from Facebook. We can ensure the other organizations are listening to this, and then we'll introduce a couple of our other speakers, which is Dr. Rao will be speaking to us on the urgent need for plasma donation, and at the end we'll have a quick update from our Chief Medical Officer of DHR Health, Dr. Robert Martinez. I'd like to send it over to Mr. Hiran Govind so that he may welcome us on behalf of the Edinburg Chamber.
All right. Thank you, everyone. Thank you, Mario. Mario and Ronnie have, spearheaded this, and I just want to say I really appreciate everyone joining the call. Obviously, this is a need right now, and information like this is something we all need to focus on. I'm hoping everybody is staying safe and, following all the social distancing rules, wear your mask. I'm a firm believer in that, and I believe we all do our part. We can get through this pretty quickly. And once again, thank you on behalf of the Edinburg Chamber and our board of directors.
Thank you so much, Mr. Govind. Thank you so much for leading the Edinburgh Chamber and making sure that we are promoting not only the fact that, and we can go ahead and bring it up, that the city of Edinburg is one of the largest cities that is leading the census numbers right now. So that's something to definitely be proud of. But, we need everybody involved, because this is going to definitely affect our region. So just, I know that there's slogans out there that 10 minutes, 10 questions, and 10 years of impact. So without further ado, we're going to start off, because I know that Dr. Rao is very busy, and he needs to move on to a lot of different events, and I know he's had some events also. But I'd like Dr. Rao to introduce you so you may speak on the urgent need right now for plasma donation. We do have your flyers, an upcoming flyer for the next event that we will be sending out to every chamber executive so that they may distribute to their membership. So you can just give us a 3 to 5 minute overview of the need, and we'd really appreciate it. I know that if you have to leave after that, we also understand. Thank you, Dr. Rao.
Good morning. Thank you very much. Good morning. I'm truly thankful for giving me the opportunity to be here today. As we have been discussing, there is as Mario mentioned earlier, we have now a surge in the number of cases in the valley, and particularly here in the Hidalgo County. We have a dire need for convalescent plasma. At the present time, let me just back up a little bit. At the present time, we have literally no therapeutic tool available to treat this, the COVID-19. Or the remdesivir that has been made available is actually a non-specific antiviral agent drug, which actually is not very specific for coronavirus. But more importantly, it also has other major side effects that we are encountering as we are looking at more and more patients who are being treated with remdesivir. Convalescent plasma happens to be the most effective targeted therapy that's currently available to our physicians. This is the antibodies that are present in individuals who have recovered from COVID infection. And it is a biological product, so it has very limited side effects as compared to a synthetically derived product. We have at the present time 116 patients in the Hidalgo County who are waiting for plasma transfusion. We have actually last night, up until 12 o'clock last night, we had already given out roughly close to 48 units of plasma to severely ill patients in Hidalgo. I'm just focusing my attention on Hidalgo at the present time. We have 6 hospitals in Hidalgo County which are actually engaged and involved in this particular endeavor. And in all of those hospitals, we have got some very, very sick patients who are in dire need of plasma. I advise and urge this particular group to help us get more donors to donate plasma, help us in spreading the word out to those who are in need of any particular type of help in transportation, in coming over to the plasma center to donate plasma, that we are here to help. We are providing them with a modest stipend to just offset any inconvenience that they may go through. But we are in desperate need of plasma at the present time. Across the valley, we have 194 patients right now who are in need of plasma. As of 2 o'clock this morning, we have already infused plasma to 674 patients. So our goal, and we have, as Mario mentioned earlier, or may have mentioned, we have over 10 hospitals that are actually in the valley that are engaged in this. And the DHR's role in this particular process is to lead and facilitate and to make sure that plasma is available to each and every patient who's out there who's in need of plasma. So help us in accomplishing this goal. It is a very wide initiative that DHR has taken upon itself. I'm very proud to be part of this particular initiative, but we need your help to make this a success for our community.
Thank you, Dr. Rao, and thank you so much for everything that you're doing. The urgent need out there, and that message will be relayed to each of the Chamber of Commerce executive directors. We have gotten a copy of your flyer so that they may distribute, and we also have the information that we will be distributing as well, so that they may send out to all their businesses. So again, we thank you for that. We know that you might have to leave. So at this time, we want to make sure that we have your contact information. We will provide it to each of our Chamber of Commerce executive directors from the Rio Grande Valley. So thank you for your time, Dr. Rao, and we appreciate your efforts. And we make sure that we will continue to pass your message on. Thank you.
Thank you very much. Appreciate it.
Thank you. Next, we have with us our, we'd like to introduce Chief Medical Officer and Senior Physician Executive, Dr. Robert Martinez. And Dr. Robert Martinez, I know, is very busy right now. He's going to give us a few minutes of his time so that he may share with the other Chamber of Commerce executive directors, a quick synopsis of some of the things that are being seen out in our community and our region. And also just with the fact that, all the efforts that are being done by the other health systems and the understanding there is a lot of communication going on and there's a lot of regional efforts. So we ask you that you continue to keep the frontline workers and all the healthcare workers in mind in your prayers, and that you have a positive message for them, because right now the only focus is the positive focus on saving lives. So I know, Dr. Martinez, you have a few minutes before you have to leave on to your next meeting, but I'd like to introduce Dr. Robert D. Martinez, graduate of SMU, and then went on to UTMB to receive his medical. Now he is a senior physician executive at DHR Health, and he has been previously with the Texas Medical Board. With you for a few minutes to give us a COVID update is Dr. Robert Martinez.
Morning, can y'all hear me?
Yes.
Okay, great. So, morning, Mario, thanks for having me. And, I know Dr. Cardenas was supposed to join us as well here, I think, but everybody's busy running around. Welcome, everyone. I think, I think this morning brings an interesting development just locally. And really, I think just for over a few minutes, it's important for everybody to understand what's the dynamic that's going on around us. There's really, I think, one of the biggest messages that I have is to remind everybody that we are actually in a pandemic and we're in a state of an emergency at a federal level and a state level and at the local level. I think some of the most difficult to deal with is the information campaign, right? I think what we see is a lot of misinformation regarding business as usual, if you will. We're in a state of emergency. And so that being said, operations are not normal under normal circumstances. And so expectations people-wise, I think, for the hospitals and places that they go is very important to understand. Wait times are going to be longer. There's going to be decisions made and triages needing to happen. And so I think it's really important we communicate that to the community, because it really changes the way they think about things. Number one, they're more careful. And number two, gives them a realistic expectation of what to expect should they need to come to the hospital. We're seeing, I don't have to tell you, 75% increase in hospitalization, 75% increase in ICU admissions. And so it's taxing the system 5, 6, 7 times over easily, even as fast as we move. Here at DHR, we're on pace to add an extra 300 beds. They may not be the Ritz-Carlton beds, but I can tell you, better than spending time in a parking lot with 110 degrees outside, at least with oxygen. And so we've found ways here, and I know the other hospitals are having some of the same issues, to accommodate as many patients as we can. And so it's really a frame of mind, I think, that the area needs to operate under as well, and assume is that we're operating in a disaster, a state of emergency at the state and federal level, because of the simple resources available. And hospitals aren't shying away from hiring people. There are no people to hire, or they're out sick. Even the state is having difficulty finding people and hiring people, but that's so I just want people to understand perspective-wise where we're coming from. The other important thing, I think there's been some good movement locally by the judge to try to rein in some of the issues here, which is very important for us. We know that wearing a mask, good hygiene, and keeping your distance is probably the most effective. It'll keep you from getting COVID in most instances. And so I can't stress enough those measures that are important for us to keep our family members out of trouble and keep folks out of the hospital, because the hospitals are full and really should be only for the sickest patients that need a very high level of care and coordination with the physicians and the teams that we have here on the ground, certainly in the emergency room. That being said, I think the governor has done a good job. He's got this entire state to worry about. He's got to watch the whole movement of the state and everything related to it. I think he's provided resources and will continue to provide resources, which we're very happy about. I know all the other hospitals are very happy about. There'll be some more people hitting the ground today, tomorrow, and certainly into next week. We've gotten word some of the hospitals already have some of those outreaching communities, like Stark County, which we often help, will also be receiving some of that help. And so everybody's trying. It's just that there's a lot of hotspots around the country. and they're trying to pick and choose. Unfortunately, we happen to be the hottest spot. And so we're going to see a lot of movement of people coming in over the next couple of days. And again, I'm going to thank the governor, CBRAC, and the federal authorities helping us with that. And also, we've been able to get more allocation of remdesivir. And you know, the other important part Dr. Rao just talked to you about, which I think is probably the best treatment, is for those that meet the requirement to get that, is plasma. So we need people that think that they may have been exposed and may have antibodies or have been positive in the past and now are over their illness. We really need them to start donating plasma so that when your loved ones come in, there will be plasma available. Because the good news is that we've organized that event with Dr. Rao, but everybody is sharing plasma. It's going to all the hospitals that need them, depending on need. And so we are coordinating. It may not look like it sometimes, but we are coordinating with other hospitals, resources, and sharing things when we need them. And we're going to be continuing to work towards that as far as bed capacity is concerned. We had a good discussion with the governor and his staff a day or two ago, and yesterday, including Chief Nimkid. And we're trying to come up with some ways to be able to share those resources as best possible, including people. And so I think you're going to see a move for that. And it's not because we haven't been doing that in the past. Sometimes the risk-benefit ratio, you know, is that we don't, it's best that we don't move patients around or transfer from one place to the other. The goal is not to transfer them out of the region. And I think we've done a relatively good job of doing that. That means that your family members and your patients that you know can stay here close, you know, to where they live. Sorry, a lot of rambling, but a lot of information. I want to make sure and get some of that stuff in.
No, thank you so much, Dr. Martinez. And we understand the importance that our business community, our business leaders, and our executive directors of our Chamber of Commerce need to continue to pass that message on to all their businesses in their own cities, that positive message that we do have a strong healthcare force and that they are doing everything in their power to provide this process that we're going through. So thank you, Dr. Martinez. We understand you're heading out to another meeting, but we appreciate your time and your effort. And we want to make sure that we will make sure that the message of positive reinforcement and providing that that gratitude and appreciation for our healthcare workers will be provided to all our chamber executives. And again, we want to just make sure that the Chamber of Commerce here in Edinburg is always at your service. Thank you for your time, Doctor. I know that you'll be leaving.
Yeah, thank you, Mario. I appreciate it. And if I could say one more thing, I think
yes,
as we look to hopefully solve this issue, you know, I think as leaders in the chamber, we really need to push the message of compliance, like you just heard. It really is a community effort. It's a local effort. Nobody from out of this area should be expected to come solve these issues for us. We have to start solving our own issues. And so they're going to help and provide supplies to accomplish that goal. But the mission should be ours and the goal should be ours. We should be doing everything in our community. Our leaders should be stepping up at every level, making sure that there is enforcement, there's recommendations to follow these guidelines. If we do that, like we did the first time, we shouldn't have a lot of big issues. But we always, it seems, what I see is complacency and looking for somebody else to come save the day. And we don't need anybody else to come save the day. We can save ourselves. We just have to step up at all levels and make sure that everybody knows and is educated and holds everybody else accountable for the safety of those that we live in the community every day.
Thank you, Doctor. Well said. I think that the information is definitely for us to continue to follow CDC guidelines. We know what they are. We know what our requirements are, so we need to go ahead and adhere to that. And I think our businesses as well, as we continue to function day in and day out, we need to go ahead and do those. So thank you for your time, Doctor. I know you'll have to step off, but we appreciate it, and we appreciate the efforts at DHR Health.
Thank you. Have a good morning, everyone.
Thank you. Next, we have with us from the Census, we have Mr. Albert Morales. He'll be contacting us and making sure that we are providing that information that is badly needed. And something that is important to us, of course, is the fact that, you know, the information is out there, the awareness is out there. Now it's time for action. And we're a great friend of ours, Alberto Morales, that is leading this effort with his colleagues, but we want to make sure that our chamber executives are also aware and that message gets passed on. I do see that Ms. Sally Guerra did join, and
Yes.
we want to thank you, our chairman of the board for the McAllen Chamber of Commerce. So we appreciate you being on the line. This information is being recorded, and we'll be sending it out to all the chamber executives so that they may share it on their feed. Next with us is Alberto Morales.
Good morning. Good morning, everyone. Can everyone hear me?
Yes.
Okay, great. Like Mario mentioned, my name is Albert Morales, and first of all, I want to thank Mario Liscano for inviting me to be a part of this meeting. I also want to thank Ronnie Laralde for putting this conference together. My name is Albert Morales, and I'm a partnership specialist with the U.S. Census Bureau. And like Mario mentioned earlier, I am one of several here in the Rio Grande Valley. Is to work with municipalities and counties. So my focus has been to provide support to them in increasing the amount of awareness that is made for census, and also encouraging people. I'm going to go ahead and share my screen, so I'll just jump over to a presentation that I have prepared for you. And let's see if everyone can see my screen. Can everyone see my screen or no?
Yes.
Yes, sir. Albert, we can see it.
Okay, great. All right. I want to jump right into the presentation, and I want to begin by saying that in light of the pandemic, just like everyone else, we were affected as well. But we have, the U.S. Census Bureau has adapted to the 2020 census operations to this unprecedented situation. And what I did want to mention is that we've set up a contingency plan, and as well as a rapid response team to be focused on this situation. Since February 25th, we've been communicating with our stakeholders on a regular basis. An initial statement from the Census Bureau was sent out to our different groups that we've been working with, Congress, the media, our partners, and our other stakeholders. And our schedule and our operational updates have been posted to our website. So we're very transparent with the way we do things, and we've been informing every single partner that we have about these different changes that have been occurring. And just to give you some important dates to remember, a quick update. This is a very high level overview of what's to come with the census. As you know, the census window started or opened up on March 12th, and we did extend the deadline from July 31st, which was the end of this month, all the way until October 31st. So internally, I want people to know that we have until October 31st to respond to the census, but what the message is respond now through the internet, by phone, or by mail. So that's the main message that we have for people today. A couple of the other initiatives that we're going to be undertaking is the group quarters initiative. That's where we count people that are in prisons and in dormitories. That's going to run through those dates, April 2nd through September 3rd. Our update leave operation has already been accomplished. And what that is we left packets for everybody that has a P.O. box and doesn't have traditional mail delivery. We already left them a packet with an invitation for them to respond, and also a paper form for them to respond through mail. Our no response follow-up period starts on August 11th and it runs through October 31st. That is when we start visiting people and knocking on doors of people that have not yet responded to the census. So we tell people that if they don't want somebody visiting their place, their household, especially right now with the pandemic going on, we encourage them to self-respond. Our service-based enumeration, that is going to happen September 22nd through September 24th. That's where we count all the homeless people. We go to soup kitchens, we go to the Salvation Army, we go to places where normally homeless people congregate, and we enumerate The enumerate transitory locations, that is when we enumerate people that live in non-traditional housing, like marinas or RV parks, places like that. That's going to occur September 3rd through the 28th of September. And of course, we do have by mandated by the Constitution, we do have to present our apportionment counts to the president, and that will happen on April 30th, 2021. And then July 31st, 2021, the states receive this information for redistricting purposes. So that's kind of like a high-level overview of what's going on. We really don't have to worry about a lot of these things except for getting people to self-respond. Over the past few months, our outreach efforts have been largely comprised of email campaigns, social media events, text messages, public service announcements, and we've done this to be able to support the stay-at-home orders and the social distancing orders that we have in place. And of course, as you know, that's very important to be able to keep from spreading COVID-19. So we're trying to pivot to a more digital way of doing things. And so far it's worked out. We've seen a lot of people respond to the census already, but we still need a lot more people to be able to respond as well. So that's why we're asking for the Chamber's help to be able to do some of these things and really make a big splash, a big effort to encourage people to respond to their census. You know, as state and local governments begin to reopen, we have resumed our in-person outreach efforts. So we are out in the field, but we are in compliance with state and local public health regulations. We are extending and adapting our advertising and our communications efforts. If you notice by this slide, we have partnered up with over 360,000 organizations throughout the country. Here in the Valley, what that looks like is we have over 1,000 partnerships that we have been working with. As you know, counting everybody that lives in the United States is not an easy task. So we need everybody to be able to assist with doing this. So that's why we formed these partnerships. Aside from that, these partnerships are the ones that have the trusted and the familiar voices. And so it goes a long way when partnerships, carry our message and really promote the mission of the census, which is to count everyone once, only once, and in the right place. Also, if you notice here, throughout the country, we hire approximately 500,000 census workers. We become the nation's second largest employer during this time. Here in the Valley, we will be hiring close to 4,000 census workers to be able to make sure that we get a complete and an accurate count here in the Valley. The other thing that I wanted to share with you are the response rates. And these response rates trickle down from the national level all the way down to our local levels. And so as you can see, the national response rate is currently 62.3%. What that means is that 62.3% of households in the United States have responded to the census. In Texas, you see that number is a little lower. It's 57.2%. In Cameron, it's 45.4%. Hidalgo is trailing the state, is a little bit behind the rest of the state at 47.2%. Stark County is at 39.4%. And as you can see, Willacy is the lowest at 36.2%. So we still have a lot of work to do. The good thing is that we still have time and people are still able to self-respond. They will be able to do that until October 31st. If you want to keep track of your individual community's rates, we have a URL here that you can access at any time. And on that site, you're able to check every single area's response rate. We've been sharing that information with a lot of the complete count committee chairs, with a lot of the elected officials, with the mayors of the cities and the county judges as well. So, I know that we're in challenging times. And, it's a little tricky right now with the situation that we're experiencing, but nonetheless, the 2020 census is of utmost importance, and we want to make sure that we promote it so that way we get as much of the funding and as much of the representation that we deserve in this area through, of course, census data. So again, I'm going to ask the chambers to please continue pushing for the 2020 census and to help us get our message out there and to motivate everybody in their networks to respond as soon as they can. Thank you very much for your attention. I appreciate the organizers again for inviting me to this meeting.
Thank you so much, Albert. Thank you for everything that you do and for making sure that we are being counted. And that's something that's very important. And I'm glad that we will be sending this information out to our different chamber executive directors. We're very proud that on our own board, we have, I know we talked to Heron and we push for every board member to have their census done. So I'm going to challenge all the other chamber executive board members to make sure that they're part of the census and that each chamber provides at least one social media venue to send out your information. So thank you so much, Albert, for everything that you do. And I appreciate the efforts of the Census Bureau that's down here. And we will go ahead and share your information with all the chamber executives as well. Next, we'll have Mr. Carlos Martinez. Carlos Martinez is with ACT. And of course, ACT is the advocacy agency on that's promoting voting, and it's something that's very important to us with this upcoming voting cycle. We also know that there is some limits on when somebody can register. There is going to be the new dates for early vote, and you all can see how important this last election took place, and also the things that we learned from learning in as far as making sure that when we're voting that there are certain guidelines to follow. So we want to thank each and every one of you all that are joining with us. And next we have Carlos Martinez with ACT for 3-4 minutes on the importance of voting.
Hi, good morning, everyone. First, I want to start by thanking Mario Liscano for inviting me, and also the Edinburg Chamber. And also I want to give thanks to Albert Morales. I know that we're a partner of the census, and we want to help the census as much as we can, because as you know, voting, just like the census, go hand in hand when it comes to representation, funding to our community, and all these other resources that we can get to our area. Unfortunately, with COVID-19, as it has affected everyone. And to add to that, we have a major election coming, the presidential election coming this fall. And we all need to work, especially in the community, to get everybody ready for it. Just like the census, voting is really important, and we gotta make sure that everybody's prepared with the correct information. And really quick, I wanna give you a couple of numbers as to what happened in the runoff election. And just some things that we noticed, that the counties are actually helping, and they're changing some of their procedures. So that way everybody can remain safe when they go to the polls, and people can be secure that they're going to a safe location, and they're not afraid whether they're gonna be too many lines or so on. But currently, this past election, as you know, the runoff election is a very small election in the sense that you don't see a long ballot the way that you saw in the primaries or the presidential election. And so having said that, we had approximately 42,000 people in the whole entire valley come out to vote. That's out of 600,000. That's only 7%. Now, compared to the 2016 election, the average is, the turnout is not that different. In 2016, we had an 8% voter turnout. And even at the extent that the election had to be moved due to COVID in Texas. So originally it was supposed to happen in May, but because of the outbreak and the pandemic, it was moved to July. So other than that, like I mentioned, I spoke to other counties, elections administrators, and they were all keeping with the social distancing at each polling location. They require and strongly recommended that people wear masks. They sanitize every polling station, and they offer different things. So all the counties were offering curbside voting for people that asked for it. They also, you also have the ability of voting by mail. However, the requirements weren't changed. So in Texas, to vote by mail, you need to qualify. it's an application with your county, and you have to fall under several criteria, which is if you're not in the county during the election or early voting, you can apply and vote by mail. Or if you're over 65 years of age, you can apply vote by mail. And even to the extent that maybe you're sick or disabled, when you apply, you can do that, and you won't be discriminated whether if you consider yourself disabled for whatever reason, or if you're sick of a condition that you cannot go vote, you can still apply and be eligible. So what we noticed, and when I spoke to the county, was that everything went smoothly. However, this is again a small election, so we cannot really grade this as something that could happen in the fall. But there was something that the county said that it could become a problem in the fall, and that is that election workers. There's a lot of election workers, especially the people that are election workers, they're retirees and they're the elderly. So several of them opted not to volunteer. However, this is a paid volunteer position. They opted not to volunteer because of everything going on. So they were a bit understaffed. This is something concerning for us, and we're gonna be working with the county to see how we can recruit more election workers for the fall and be ready for that. And another issue that it's coming up is that there's very few people getting registered to vote. And so there's very few cards that are being turned in, and we have experienced this at our office. We started this year really registering a lot of people, mainly at events, at school districts, and this number has substantially decreased because of the lockdowns, closures of different businesses, and especially COVID. And so that's where we need a lot of help, promoting voter registration, because we don't want to, at least as an organization, we don't want to see what happened in 2016. So you know a little bit. In 2016, a lot of people were getting registered to vote. It was another presidential year, but we noticed that even at that, when we were registering in great quantities, we still had people the last day to register to vote forming a huge line on the elections office. And so we want to make sure that everybody's prepared and try to avoid the spread of this virus. So as much as we can. So as an organization, what I'm trying to do with our partners, and what I'm gonna ask the chamber and Mario to see if he can share it with you all, we're creating a toolkit with a lot of marketing materials for voter registration. We have been working with other nonprofits where they have been creating sites where people can actually request voter registration cards to be mailed to them, which facilitates voter registration. It's just a matter of signing up, getting your voter registration card by mail, filling it out, and putting it back in the mailbox. And so that's what we're trying to do. We're gonna try to implement that with school districts. Also, the counties themselves are doing that. So if people call the elections department and ask to be mailed a voter registration card, excuse me, they will get it. And so the last thing I want to leave you with is the very important dates for the election. The dates have not changed. They're still are the same dates. So the presidential election, it's going to be November 3rd of this year. Early voting is going to start from October 19th to the 30th. And the last day to register to vote is going to be October 5th. So if people don't register by then, unfortunately, they won't be eligible to vote. And oftentimes people assume that voter registration is forever, or just because you are a US citizen, you automatically register to vote, and it's not like that. Voter registration is an application that we often have to do it and renew it, especially if we move around, made any updates to our information, has to be done. Or even at the extent that we haven't voted in years, we might consider doing it again, because chances are that we might no longer be in the voting list. And so it's very important. I know that many of you have helped us in the past, and for that we're very grateful. And we're here. So we have posters, marketing materials that we can provide you with. Like I said, I want to also give you access to that toolkit that we are creating. And in it, I'm working closely with Albert Morales, so we can also provide you with information on the census. There's a lot of marketing materials that they provide. Just last night, I was looking at different videos where they really truly explain how to fill out the census, and that's great. And so whatever else we can do on our end, we're open to any suggestions that you may have. If you have any events in the future, we're more than happy to attend and help with voter registration. And again, I'm thankful for the Edinburg Chamber for inviting me, and also Mario Liscano. And so we're here to see how we can increase the vote and make sure that everybody has a voice this November. Thank you.
Thank you. Thank you so much. And just as a reminder, I just want to make sure that the Advocacy Alliance Center of Texas is a nonpartisan, nonprofit organization, which is very important because they are definitely a voice for our entire region. We will be sharing your contact information, and we thank you, Carlos, for everything that ACT is doing and your services, ensuring that we continue these voter registration drives and of course, passing the information that you just shared with us so that we may, all of us at the chambers, be able to promote your message, which is we need to register and we need our voice heard. Thank you today for joining us. And as we're concluding this program, I just want to thank each and every one of you that have joined us either via Zoom or have provided the information request through our means that we're going to send it out is recorded. And we want to ensure to our community that all the chambers will be working together when it comes down to things like the pandemic. And so I want to thank all the chambers that have already passed on the message on the urgent need for plasma. And we ask you now that you continue to pass that message on, making sure that we're registered to vote and making sure that we are also participating in the census. So special thanks goes out to Ronnie Laralde, and he'll be closing out this session as far as the upcoming events and some of the information from the Edinburgh Chamber of Commerce and of course the Edinburgh Chamber of Commerce staff for everything they do. And also thanks to our leader on our board of directors here in Gavin, who is ensuring us that we continue to pass these messages on to our community. And we do ask you that you continue to follow all your CDC guidelines and ensure that this information is vital for each one of us to ensure that we follow up. So if Mr. Heron can close us up and Mr. Ronnie can do the last remarks, and we'll finish off before our hour is up.
Right. Thank you, Mario. Some very good information today. I'd like to thank all of our special guests who spoke. Very good information all the way across. Great presentation. Also, like to thank all of our chambers that joined us across, and my fellow counterparts. I see Sally there. How you doing? I really appreciate Ronnie and Mario putting this together. I feel like we did a good thing, and that the fact that we recorded it and we're gonna be able to spread it out throughout the community is also great. So once again, I appreciate everything on behalf of Edinburgh Chamber of Commerce and our board of directors.
Thanks, Aaron. Thanks, Mario, and everyone who tuned in today. We appreciate that. I know we have a few chambers on the line. I know we have Far Chamber, La Feria, and then, of course, McAllen with Sally. Thank you all. And a few others that will definitely get this information distributed. Obviously, this is, a different time for all of us. And I think, chambers have played a very important role as far as being that, voice for business, and also they work really well with, the city leaders and public officials. So I think we've played a pretty vital role, and we need to continue to do so. I think the chamber consists of, the board members that are part of the community and are feeling the impact firsthand. So it's great to have this organization part of, everything going on at this moment. Once again, thank everyone for joining. If there's anything we can do, I know on behalf of the board and the staff, we're always open to helping spread information, any ideas, contributing, collaborating, everything we can do to help. Right now, it's just, like one of the doctors said, it's everyone versus COVID, and that's the way it needs to be. And we're a big family in the Rio Grande Valley, and we need to continue to operate that way. So once again, thank you all for everything, and please like us on Facebook. Keep up with our information and our events coming up, and we look forward to seeing you in person down the road. Thank you.
Thank you.
Bye, everyone. Have a great day.